Dr. Robert Benson for Good Day, Good Health. Today we have Dr. Brett Coldiron of the American Academy of Dermatology and Superbowl Champion Phil Simms. Today they're going to bring our awareness to a relatively unknown disease. Hey gentlemen, welcome to Philadelphia.
It's always a warm welcome from the Philadelphia fans when I go there.
City of brotherly love.
Oh yeah.
That's only when we win.
That's it. That's exactly, well, that's the same in every NFL city.
Well, we're still trying to win a Super Bowl like you. But seriously, we at Good Day, Good Health applaud your efforts to bring awareness to this devastating disease of melanoma, especially doing so through the Spot Me program.
Yeah, well, that's why we're here today, is to raise awareness and to let people know what they can do about skin cancer. And why I'm here, Dr. Coldiron here can give you a lot of the facts, but I'm here because I've dealt with it. 4 years ago, I was diagnosed with skin cancer, so I've gone through the treatments. I had a great dermatologist. It's really helped me, and I've gotten rid of a lot of problems. And I want to tell people out there, don't be stubborn. Go to your dermatologist, get screened for skin cancer, and if nothing, it'll just make you feel better because it's one less thing you have to worry about in life.
Okay, so Phil, with all the pre-participation physicals that the average athlete receives in high school, college, and the pros, why was it your daughter that noticed the lesion on your skin and convinced you to investigate further?
Well, I think, I'm just one of those guys. I was a little stubborn and thought, well, that spot's going to go away. I'll be careful. I'll wash it. I'll put some lotions on it. And what I found out, that was not good enough. My daughter takes great care of her skin. She made the appointment and actually went with me. So I give her a lot of credit there. And of course, since that happened, I'm not afraid to tell people, to tell them to go to see their dermatologists and to tell them my experiences and hope it helps them.
Well, Phil, you're certainly blessed to have a daughter that cares about you. I think mine cares about me too. But we asked the question really though because we're concerned that the awareness of melanoma is just simply not there or at the forefront. Accordingly, if we bring the awareness of skin cancer to the same consciousness that we have, say for instance, concussions, then it will most certainly lead to the safety and protection of our athletes in general.
Well, listen, let me just say this. First off, the team doctors that I was associated and what's going on now, they're very on top of everything. So, yeah, they were looking, hey, back when I was playing, my skin looked pretty good. But it's all the burns and all the exposure I had that I came on to me later. And of course, you're talking about the concussions and all that. Look, the NFL does a great job changing rules, equipment, everything they're doing. They are trying to help these players, and I think we're going to see these improvements and players come out of the NFL after long careers in much better shape than we've ever seen before. So, yeah, they were checked our skin even when I played. They're very conscious of the coaches in the league because they're older and they're out in the sun a lot, and they're on top of things, no doubt about it. Right.
It's also a great opportunity to educate the players about the use of sunscreen and how to sun protection, how to wear a hat, and when they don't have a helmet on, and how to plan their day so they're not out there in the middle of the day burning themselves, because there's an epidemic of skin cancer in the United States, and there's a lot of melanoma in Pennsylvania. There's over 4,000, going to be 4,000 this year, which is fourth highest in the United States. And of those people that die from melanoma, men die 2 to 1. Twice as many, and we think it's because they're stubborn and they won't go in and get their spots checked. So we want them to go to spotme.org and find a free skin cancer screening and go get their suspicious moles checked out and learn how to do a skin self-exam and also learn all about skin cancer. And we're hoping it'll save lives. We think it will. And the men are the stubborn ones, and we want them to come in, and the young men are the most stubborn of all. So I think it's wonderful if you can teach them about sun protection when you're doing their physicals.
We at Good Day, Good Health will be following this discussion with further programs on this timely health issues.
Thank you.
Thank you. Factor 30 or greater.
Back to you guys.